Hello, my name is Sophia. It is a great pleasure to be here with you all today. Today, I'll be presenting on the wealth gap and its effect on treatments and quality of care for the disabled. Here's a quick overview of what I'll be presenting to you all today. An introduction, my personal experience, a quick background, then I will talk about American Ethiopia on its health gap and its effect on its disabled citizens. And for my closing, I will ask the question, what can we do to spark a change? Before I begin, a little bit about me. I am a rising junior at Robinson Secondary School in Fairfax, Virginia. Listed are some extracurricular activities I'm involved in. When I grow up, I aspire to become a neurologist and contribute to the global health community. You will see why more in depth in the next slide. My personal experience. My brother Amir was a disabled person who passed away from Duchenne muscular dystrophy 3 years ago at 16 years old. Amir was the closest person to me ever. Every day I would walk home with excitement to be able to care and be there for him. As a little girl, there had been many nights my bed was a hospital room chair. It's made me grow up faster, but it's also made me the person I am today, who is stronger, more passionate, hardworking, and who is ready to make a difference. I've seen firsthand what it means to be disabled in America. That's why I'm here today, bringing awareness to the difference of care for citizens in low-income countries like Ethiopia. Seeing these disparities has led me to start funding to provide Ethiopian disabled kids necessities their countries do not provide. This is Mubarak, an 11-year-old boy that I help in Ethiopia who has muscular dystrophy disease. Mubarak's mother carries him on her back to school every day, and he was denied education from nearby schools. Mubarak has no health insurance and a lack of resources that I've helped provide, including the wheelchair he's on. It's saddening seeing the drastic difference two people, Mubarak and my brother, have to face that share the same disease. I look at this picture and it reminds me why I work hard every day, for each and every disabled person whose life isn't valued. But first, what does disabled mean? It means impaired or limited by a physical, mental, cognitive, or developmental condition. According to the World Health Organization, disability has 3 dimensions: impairment, activity limitation, and participation restrictions in normal daily activities. So what does being invisible feel like? How does this relate to disabled people? What factors cause this? So the definition is treated as if unable to be seen, ignored, or not taken into consideration. Some people don't want to acknowledge sickness, disability, and difference. It can leave the disabled population feeling ostracized and unimportant. Individuals have a concern with their self-presentation. The disabled can feel as a condition and not a person. Their shyness stemming from being teased, bullied, being self-conscious, feeling as a burden, having to rely on someone and be dependent can affect a person's mental health. But also, the disabled people can feel as outcasts in society when everything is structured for the non-disabled and they feel as though they don't fit in. The Convention on the Rights of Persons with Disabilities is an international human rights treaty of the United Nations that creates legislation and policies to support disabled people. In addition, stated from the United Nations, some general principles of the CRPD are equality of opportunity, accessibility, full and effective participation, and inclusion in society. These are the base countries I'll be using today: America, a high-income country, and Ethiopia, a low-income country. I will start off with America. According to the CDC, 61 million adults in the United States live with a disability. 1 in 3 do not have a usual healthcare provider, and 1 in 3 have unmet healthcare need because of cost in the past year. So you might ask, what is America doing for its disabled citizens? Well, America has signed the CRPD, however, it is not ratified. The Individuals with Disabilities Education Act is the nation's special education law ensuring children with disabilities the right to a free and appropriate public education. It provides the necessary requirements to give students a fair education, from special desks and seats, personal assistance in each class, and more. These are provided through an individualized education program called the IEP. American with Disabilities Act of 1990 is a civil rights law that prohibits discrimination based on disability in several areas, including employment, transportation, public accommodations, and access to state and local government programs and services. Health insurance. Medicare is a federal program that provides health coverage if you are 65 and older or under 65 and have a disability, no matter your income. It helps currently disabled and those who cannot work. They are paid based on an individual's average amount of earning during their working years, and they're paid Social Security taxes on their earnings. Medicaid provides free or low-cost medical benefits to people with disabilities if you have a low income. But what about the people who have a disability, don't qualify for disability benefits, and need health coverage? Well, the Affordable Care Act offers options for those people. These resources are provided by America's tax dollars. In 2015, disability-associated healthcare expenditures accounted for 36% of all healthcare expenditures for adults residing in the United States, totaling $868 billion. Medicare paid $324.7 billion, and Medicaid paid $277.2 billion. Access to quality healthcare is an important indicator of well-being in the United States. This is a poverty stat for America between 2008 and 2019, between people with and without disabilities. America has more than double the percent poverty rate for people with a disability. Although America has greater opportunities, the system continues to put them at a disadvantage. Why are the disabled more likely to be in poverty? Well, poverty will persist among people with disabilities and other marginalized groups until policymakers level the playing field for disabled workers while also guaranteeing access to the services people need to make ends meet. Disability can lead to exclusion from work, education, high healthcare, and other expenses, which can cause or exacerbate poverty. People with disabilities experience many barriers in accessing services, including health, education, employment, and transportation. Ethiopia. Little in the study area is known about disability in Ethiopia. 15 million Ethiopians are disabled. Something in which is very surprising is that Ethiopia has actually signed and both ratified the CRPD, but in many ways they lack the ability to implement policies to improve the care of disabled persons. As you can see here, families as well as communities discriminate against people with disabilities. They are seen as objects of charity that can't contribute to society. As a result, they are affected psychologically. This stigma reveals inadequate education towards mental and physical disabilities. Educating ourselves is the most important step at dismantling the generational stigma. Here's some stats. 17.6% of Ethiopians live with disabilities, in which 95% of them live under the poverty line. 30% of all disabled people are under the age of 25, and only 1% of Ethiopian buildings and roads are fully accessible to the disabled. Healthcare. Ethiopia technically has free healthcare, which is provided by government-run hospitals. However, the reality is that there are very few hospitals and they have extremely inadequate staffing, supplies, and machinery. According to the World Health Organization, Ethiopia's healthcare sector is financed mainly from loans and donations from the US and other rich countries. So what can you do to spark a change? Educate yourself. Disabled citizens are more than just a disability. Pressure legislators on adapting policies. Be considerate. Some tasks may be more difficult for these citizens, so be polite and be patient. Understand that disabled persons are just as beautiful, kind-hearted, funny, and caring than anyone you can meet. They also make amazing friends. Donate to the Disabilities Rights Fund. Reach out to local organizations and volunteer. Any help makes a difference. Here are my citations. And I really want to thank the Global Health Leader Conference at Johns Hopkins University team for giving me this amazing opportunity to speak about something that is very personal to me and that I'm very passionate about. To my parents that have been so supportive, and last but not least, you all, for giving me the time to share an important global issue. We are the next generation, and now is our time to stand up and rise to the plate to help the one world we all live in. Thank you.